Dr. Michaels brings 10 years of experience in leadership to OSHA that has been sorely missed in these past 10 years, and he brings a commitment to workers' protection and workers' safety that is near and dear to our heart at the New York City Central Labor Council. Nationally recognized as a leader in the scientific community's effort to protect public health and enforce environmental procedures and policies. Before his appointment to OSHA in 2009 by President Obama, Dr. Michaels was a professor of environmental and occupational health at the Georgetown University School of Public Health and Health Services, directing the department's project on scientific knowledge and public policy. You must have a hell of a business card.
I'm trying to do it bilingual.
Yeah, maybe these initials would have been long. Anyway. From 1998 to 2001, Dr. Michaels served as President Clinton's Assistant Secretary of Energy for Environment, Safety, and Health. In that position, he was the Chief Architect of the Energy Employees Occupational Illness Compensation Program. This historic initiative to compensate nuclear weapons workers who contracted occupational illnesses as a result of an exposure to radiation and other hazards. This program has provided more than $5 billion in payment to sick workers and the families of deceased workers. Dr. Michaels has been a strong advocate for ensuring worker safety and has been leading efforts recently to ensure that worker safety among the oil spill cleanup crews responding to the recent BP environmental disaster and the safety of our coal miners after the recent tragic death of the 29 miners in a fatal explosion in West Virginia. Last year, well actually in 2008, over 5,000 workers lost their lives in their occupations. And nobody's more aware than New Yorkers that if that happened in one single incident, there would be a hue and cry and we would be marching in the streets. But because unfortunately, many of them are single workers that lost their lives, or like these 29 miners, sometimes it appears to get swept under the rug. And thank God that we have somebody like Dr. Michaels that's able to help us. Dr. Michaels knows the work that our workers do, the oil spill workers, the coal miners, and those others that work in hazardous conditions on the front lines. He realizes that it must always be done, it must always be our top priority that their work is done safely as possible. Under Secretary Solis's leadership and with Dr. Michaels' strong background in protecting workers, we can bring back more vigorous enforcement of the workplace safety and health standards. One tragic worker's death is one too many, and hopefully in 2010, with your help, Dr. Michaels will be able to reduce that under the 5,000 number. It's my pleasure and honor to have an opportunity to introduce to you Dr. Michaels.